you all have some background on what cardiovascular disease is and how this affects us internationally, you may be wondering how this is being addressed. And the World Health Organization has placed a lot of emphasis on cardiovascular disease and eradicating this internationally. So once again, the overall issue is cardiovascular disease caused by unhealthy lifestyle and hereditary factors. So heart disease is a leading cause of death in every country in the world, and it has seen continual growth throughout the years, as discussed in my previous video. And also, as a review, tobacco users, the obese, those who suffer from high blood pressure, and the physically inactive are more susceptible to contracting cardiovascular disease. And based on a quote from the Center for Disease Control, about half of Americans, or 47%, have at least one of the risk factors contributing to heart disease, and more than half of the deaths due to heart disease in 2009 were found in men. So here's an overview of the World Health Organization. So the World Health Organization has been in existence since April 7th, 1948, and they celebrated their 70th year of operation in 2018. Their mission statement is that the bulletin seeks to publish and disseminate scientifically rigorous public health information of international significance that enables policymakers, researchers, and practitioners to be more effective. It aims to improve health, particularly among disadvantaged populations. So basically what they're saying is that their main goal is to increase public health awareness, and so that policymakers and researchers, especially in less developed countries, can make better decisions about how to address certain health issues among their specific populations. This map shows where the World Health Organization is present. So as you can see, they have a presence in almost every single country in the world, but the black dots shown on the map show where their headquarters are in each of their regional offices. The work of the organization. So Dr. Tedros Adhanom is the Director General of the World Health Organization. Also, the World Health Organization works closely with the United Nations to help achieve their goals. Additionally, over 7,000 people from more than 150 countries work for the organization in over 150 WHO offices, 6 regional offices, at the Global Service Center in Malaysia, and at the headquarters in Geneva, Switzerland. So as you can see, they make a huge international impact and are stationed in various places in the world. So you may be wondering how the World Health Organization is funded and where they get the funds to accomplish all their goals. In 2017, their total budget was $505.9 million, with donors and financial campaigns being the primary source of funding. And as you can see from this graph, the Bill and Melinda Gates Foundation was by far their greatest donator, followed by the Gavi Alliance, the World Bank, Rotary International, and the National Philanthropic Trust. So how has the World Health Organization responded to cardiovascular disease? Well, the WHO has established community programs within areas of high risk for cardiovascular disease by developing surveillance methods to monitor the growth and decline of heart disease globally, but more specifically, they have implemented tobacco control policies, taxed foods that are high in fat, sugar, and salt to discourage consumption, built walking and cycling paths to increase physical activity, implemented strategies to reduce alcohol abuse, and provided healthy school meals to children. So all of these efforts have been indirectly placed to reduce cardiovascular disease by increasing a healthy lifestyle and physical activity, and just making populations overall healthier. So how can you help? If interested, you can work for the World Health Organization in your region. Our region is the Pan American Health Organization, and you can do so by entering the link in your web browser and filling out the volunteer application. Additionally, encourage the implementation of healthy habits into your life as well as your family's life. Thank you.